Thanks very much, Nizam. Hello, everybody, and welcome back to the Breakfast Club. You're with me, Ben Ibrahim, and you're joining us for this week's segment of Healthy Living. And today, we're talking to Datuk Dr.Nor Ashikin Mokhtar, founder of Primanora Medical Center and a gynecologist. And we're going to talk about, to all you aspiring mums and dads out there, on how to have a positive baby delivery using the Ceaserian technique. Datuk, or Dr. Nora, thank you very much for being with us. How are you?
I'm great. It's a pleasure, Ben, to be with you.
Oh, it's a pleasure to be with you. Oh, not everybody says that every day, but I'll, take my compliments where I can. But before we get into it, Datuk, tell us a bit about yourself. How long have you been practicing the medical practitioner's call? How long have you been doing this job? And yeah, tell us about yourself, really.
Well, I've been practicing for about a quarter century now, I should say.
You still look great, I have to admit. What's your secret? Please share with us.
Okay, that would be another day.
Another day, another session.
Another session,
with Dr. Nora, yeah.
Right. I'm a gynecologist and practicing now, having my own medical center, Primanora Medical Centers. It's an outpatient, one-stop healthcare center for women, looking after the healthcare needs of the woman throughout the ages, literally from womb to tomb.
Mm-hmm. Womb to tomb. Yeah.
Yes, yes. For diagnosis, disease management, wellness maintenance, healthy aging, and also aesthetics.
Okay.
Non-invasive. Yeah. Without surgery, so that's an option for the woman.
Now, Dr. Nora, I know many people out there, many aspiring doctors look at you as a role model. You're very visible in the media. We love your articles all the time in the Star newspaper and Star Health.
Thank you.
But why gynecology in particular? I mean, out of all the medical disciplines that you could have specialized in, why that specialization?
It's actually fulfilled my purpose in life,
right.
And that is just actually to serve the woman,
right.
And I find no greater pleasure than to serve the woman, because I think I understand women better, coming from where I come from, literally going through the ages and also the challenges from childhood, literally, growing up with my women, and I would say that I'm also very comfortable with them, and also do have sympathize with them, and that will be my lifelong mission, to actually uplift the quality of women's health.
Okay, great, great. Very inspirational indeed. Now, Dr. Nora, we're talking about how to have a positive baby delivery using the Ceaserian technique. Now, before we get into the Ceaserian technique area, now you see a lot of patients every day, and I'm sure many females say to you, Dr. Nora, I want to do natural birth. Should I do Ceaserian? So what are the pros and cons, so to speak?
Well, first understand that is it major surgery or versus Mother Nature? Okay, so vaginal delivery, as we know, traditionally through the vagina, and Cesarean delivery means delivering a baby through the abdomen, having straight incision just above the pubic bone, at the bikini line,
right.
And usually resulting in a nearly invisible scar at the end of the day.
An invisible scar, yeah, because many people think that if I have that surgery, that C-section surgery, I'm going to be scarred for life, basically, but well, nobody can see it. But
yes, you can have a scar, but you can hide it with a bikini unless you want to go, Yes, you see. Yeah. So, and actually, when it comes to birth choices, it's the woman's right. And as long as it doesn't go against medical ethics. I mean, there is a caveat that if you want to go for, say, Cesarean delivery, of course, no doctor would ethically have your baby out before term.
Of course.
And that would mean like 38 complete weeks, you see. So, having said that, you see, because there's still this minority of women who says, oh, I want natural childbirth, I want pain-free delivery, or I want to deliver my baby underwater, okay?
Really?
Yes, they have the water birth. And then this minority says, I want to have an elective Cesarean delivery. So this is where, when it comes to women's rights, we have to respect the choices, as again saying, where in some areas we do have to be, we have to temper some medical judgments here against so-called evidence-based medicine.
Because everybody's different, in terms of their body, their health, how fit they are, the number of vitamins they're taking, their lifestyle,
right?
And
also what is it that they want in life, you see. So when we look at Cesarean section, there are a lot of negative things being said about that. And
this negative stereotypes,
Yes, I mean, the society are quick to give medals to those women DIY vaginal delivery. Great, you had a vaginal delivery, and maybe give a lot of disparaging comments on women who opt for Cesarean sections. Oh, they're too posh to push, so that's why they're having Cesarean. But you have to look at each woman's life individually.
And
their needs.
You can't stereotype.
Right, you see. Because again, it's an option. Because again, when you talk about what are the pros and cons of Cesarean section, given the health care that she's receiving, see, particularly I'm talking about in private practice, and this woman perhaps she has an option to cesarean delivery. I can time it, I can schedule it. My husband will be around, otherwise he's outstation.
That's right.
God knows when baby might pop up and nobody might be there, you see. And she might be have decided that, you know, in my family or my future I only want maybe 2, 3, or maybe just 1 child, and I want
family planning comes into it. Yes,
so-called the safest delivery, and where my family support will be there, and I'm prepared.
Right.
You see, and I have the choice of going to this hospital to have this doctor to deliver for me. So all this come into play, and we as doctors will have to look at her and say, look, if you do go through vaginal delivery, these are the outcomes, and so is cesarean.
And these are the factors that you have to take in.
Yes, okay. So yeah, I mean, when you talk about cesarean deliveries, and if you compare it, if for a woman who is prepared, particularly in private practice, they are women who has received very good health care.
Of course.
All right. So and a lot of the studies that are done, I would say they're quite, I would say flawed, but quite skewed, you see, because when you make comparison about the negative things here about cesarean deliveries, that, you know, higher morbidities or great risk of complications to the mom. This is because more or less we're talking more on those that when they do those studies are more in training hospitals, where you have emergency coming out from women from rural areas, indigenous groups, you know, who never had any, or immigrants who never had any medical checkup, have got a lot of diseases.
Whole medical history, basically.
Yes, you see, so that's why when we had to do an emergency cesarean, they end up having lots of complications. But someone who's well looked after right from the beginning, good antenatal care, have made this decision, the risk, I would say, or the safety is almost the same as vaginal delivery, and not necessarily vaginal delivery all is safe.
Yeah.
And not necessarily all cesarean deliveries have got its morbidities.
So everything does have pros and cons.
Yes, it does, you see. So again, and you look at women's lifespan now. We're living in 70s, 80s, and even up to 120. Yes, darling, we can live up to 120s,
Yes,
okay?
we read that in the paper today, yes.
Yes, you see. So look at, that's how women has evolved. But previously, we hardly live beyond the menopause. Women would die from childbirth or die from infections. But even with the live beyond 70s and 80s, we have challenges as we age, weakening of our support tissues, of our ligaments, you know, increased risk of prolapse. And when you have a vaginal delivery, literally, it's like a freight train really going through the vagina. So that does have some implications, particularly if you have repeated pregnancies, deliveries through the vagina. So it has in some ways caused some weakening to your support structures. And as you age, that's when you have risk of either urine incontinence or even fecal incontinence. And this is the pros and cons that the women have to actually weigh themselves.
I'm learning a lot here.
Yes.
Yeah, I'm learning a lot. But Dr. Nora, you said earlier when I answered my question that you said that there's a lot of stereotypes out there. And as a first-class medical practitioner, is there any stereotypes that you want to squash right here on the Breakfast Club? You know, when people say, "Oh, you know, you're a champion. You did it naturally. Oh, you're too soft to push out because you did C-section." So, is there any stereotype? Because, like you said, everybody is different. And I'm sure when someone comes up to you, you just go, "Oh, not again," you know. So here's the stereotype again, and I'm sure you want to bring out, you know, a tape recorder or a book sometimes just to sort of repeat yourself. But any stereotypes that you do want to quash right here on the Breakfast Club about both births?
No, I don't want to squash my women. I love them. I just want to say that we should not be too judgmental.
So that's your best advice?
Yes,
yeah?
my best advice is say, because there's always two sides to the story, and you should have both sides before you actually make a fair, I would say, an opinion to say, no, this is right or this is wrong, because sometimes there are no right or wrong answers. Both might be right.
Right.
Okay,
right.
So this is where, of course, for some women it's straightforward. No, you can't have vaginal deliveries. These are in conditions where the mother has got the placenta that is blocking the passage of the baby. We call it placenta previa, or she has previous cesarean sections, or she has other underlying medical diseases like diabetes, hypertension.
Yeah.
Or in this pregnancy,
diabetes is getting quite prevalent now. Yeah.
Yeah. Well, that's our society.
Yeah.
Right, the price that we have to pay. Again, or if there is some abnormalities in the pregnancy itself, where the baby has got an abnormal lie instead of where the head is down, you know, it's either it's in, like we call it, transverse position, or you have multiple pregnancies outcomes. So in this condition, non-negotiable, because we're talking about safety. That would be still the top priority for the mom. Other conditions is still where, of course, when the woman wants to come for a cesarean, she says, okay, sure, I'll do it. No, but ethically, we have to counsel the woman. Why? Have you thought about the pros and cons to it? Because if she's not prepared psychologically as well,
the mental preparation,
yes, mental preparation as well, it can also be quite traumatic.
That's right.
Okay, so these are the, I would say, where you have to see a woman individually, understand why she's having it, why she thinks it's best, and also explain to her about, if you go to cesarean, yes, these are the things that you might expect, like, a bit more blood loss, you need a bit more longer recovery time. Do you have the support there, and are you prepared for it, in the sense that, we have to look at the medical conditions in terms of whether she's got enough hemoglobin level, her blood groups, and all these issues have to be sort of addressed to her, put on the table. This is the pros, this is the cons, and then at the end, we have as doctors can only give you directions. We can't make that decision for you, okay? Because theoretically, it's still, I would say, we can say, okay, this is the right choice for you, but still, it's you that makes the decision.
It's your call, yeah?
Yes,
it is the individual's call. Anyway, on that note, hold your horses there, Dr. Nora, before we go further. This has been a great start to a great interview, to a interesting topic for all you aspiring mums and dads out there. We're just going to take a very short commercial break right here on The Breakfast Club, but when we come back, more with Dr. Nora on healthy living. We'll see you soon.